Hi, and a very warm welcome to this first introductory chapter to the field or to the science of, or to the beautiful science of community medicine or public health. Beta, in case you are preparing for your PG entrance exam, this chapter is not at all a very high yield chapter. Very rarely MCQs will be asked from this chapter. But in case you are a UG student, you are in the early phases of MBBS, you are in first year, second year, third year, or you are appearing for your UG exams, professional exams for community medicine, probably this is chapter important from you for your UG exam point of view. So, beta, the concepts of community medicine, there are 5 broad concepts of community medicine. You need to talk about the concept of health, what is health care, and then what is disease. Once you understand the concept of health and disease, then you can understand the concept of disease care. Disease care means control. The concept of controlling means what? You're going to control what? You're not going to control the health, you're going to control the disease. So that is what is a disease control or a concept of control and the concept of prevention. The concept of disease control and prevention has been taken in a separate module, which is kind of important from the PG entrance point of view also. But from UG exam point of view, from your Viva exams, this topics, concept of health, concept of disease, and healthcare is important from the UG standard point of view. So first topic of the day is what are the changing concepts of health? The changing concepts of health, how the health is being defined has been changing over time. So since the start of the human era, first we used to have the earliest concept was the earliest understanding that we had was the biomedical concept. What is the biomedical concept? That means any alterations or changes in biological functioning of a person, that is called as a disease. And if the biological functioning is absolutely okay, we say that the person is in health. So if a person comes and says my kidney levels, the urea creatinine levels are okay, that means his kidney is okay. If the ASOT, PT, everything is, the liver enzymes are okay, we say that the person is in good health. Next came was the ecological concept. That means that when do we say that a person will be healthy? If the person is in tune or in balance with the environment. If the person is in balance with the environment, we call as ecological concept. Psychological concept, if the person is mentally stable, if there is mental stability. Mental stability, the person is able to think properly and is in tune with the mental state of the body is in tune with the physical state of the body. That is the psychological concept. And then you have is the holistic concept. This holistic concept is the most recent, it is the newest thing, and it is most accepted. The holistic concept is most accepted. What is holistic concept? Common sense, very easy to understand. Everything together is holistic concept. We want a good biology, we want the mental peace, and we want the environmental peace. Everything together is called as health. And that gives you the definition of health. What is the definition of health? The definition of health is a state of complete physical, mental and social well-being and not merely absence of disease. What do you mean by this? Merely absence of disease. This is what was called as the biomedical concept. Earlier we used to think this was the biomedical concept, that any absence of disease is called as health. Now it is not like this. This is what is the WHO definition of health. The WHO gave this definition in 1948. That's all that you need to know. Next is MCQ number 2, topic number 2. What are the dimensions of health? A lot of times you get this question in your Viva exams or write a short note on the dimensions of health. So beta, you need to write these 7 dimensions. You have to memorize. It's like, I know it's tough sometimes to understand these dimensions, but that's how it is. You have to memorize these dimensions of health, commonly asked from the UG perspective. I'm saying it again. So in the UG exam, they may ask you dimensions of health. There are various dimensions of me being healthy, you being healthy. What are the various dimensions? We say that you will be healthy if you are a UG student. Physical dimension, you should be physically fit, mentally fit, socially fit, spiritually. You should have a spiritual connection, emotionally fit, vocational and other ecological dimensions. Everything should be in tune. Then we say that the person is healthy. These are the various aspects of health. Next is this point number 3. What do you mean by the concept of well-being? When do you say that you are well-being? We say that we are well-being based on 3 important things. You should understand the difference between standard of living, level of living, and quality of life. 3 important things. What do you mean by the standard of living, beta? The standard of living. Basically, standard of living MCQs or questions for you. Standard of living will talk about like what is the standard of your life, like in terms of the income, in terms of what, how big house you possess, how big car you have, what is the level of like mobile phone, smartphone you have. Do you have the high end of smartphone? Do you have a local smartphone, flip phone? What do you have? It is based on your occupation. What work do you do? Third, the standard of living is also based on your socio-economic status, whether you are in lower class, lower middle, upper middle, what level you are talking, that is going to talk about standard of living. Please note that the standard of living is different from the quality of life. You may enjoy the best quality of the mobile phones. You may have the smartest of the smartphone. You may have the biggest of the bungalow, but still there are people who will not be happy. Why? Because the happiness actually depends on the quality of life. What is the quality of life? That is happiness index or the happiness quotient, which we have discussed in separate video modules. We talked about the PQLIs, that is the physical quality of life index. Physical quality of life index is different from the standard of living. Now comes a third point. What do you mean by this level of living? That is a separate problem. So one, I have told you what is standard of living, which is different from the quality of life. Third point is, what do you mean by the level of living? But a level of living will talk about these 9 parameters. This is important from your UG perspective, 3 by 5 star question topic for you. These are the 9 parameters for the level of living. You are going to talk about the health, food consumption, education, occupation, housing, social security, clothing, recreation, and human rights. You need to memorize these. These are the level of living. The standard of life is based on income, occupation, socioeconomic status, whereas the quality of life is dependent on the PQLIs discussed elsewhere. Next is this point number 4. What do you mean by the spectrum of health? But a spectrum of health is a very relative term. Something healthy for me may be unhealthy for another person. Something unhealthy for another may be healthy for me. If I say that I eat 2 chapati, that may be healthy for me, but for a person who's on a fruit diet or a vegan diet or any good quality diet, for them, my 2 chapatis are very unhealthy. Are you getting it? So health is a relative term. So health is simple, very basic thing for health is freedom from sickness. Freedom from sickness is health. है ना? But a better word is called as a better health. I am free from, that is the biomedical concept, but I am also mentally okay. But then there is also a spiritual component. The best type of health is called as a positive health. So freedom from disease is one health. Then you have a better health where you are kind of more positive, and then you have a positive health. Similarly, on the disease aspect, you can have a disease which is what we technically call as doctors as subclinical disease, unrecognized illness. Then there is mild illness, then there is severe illness, and then there is death or complication, death or any disability. So that is the most severe type of health problems that we can have. So this is what is the spectrum. This is the negative health and this is a positive health. So the health and disease are actually linked, kind of linked. Next is this super duper important slide number 5. That is what are the determinants of health. Please note that this can be asked a lot of times. It's a 5 by 5 star UG question topic. In fact, this is the only one question that we asked always in the exam. Write a note on the determinants of health. Beta, when we are talking about the determinant of a health, that means a person who's living in the far-flung area, in the tribal area, in the forest area, in the cities, in the village, the health of that person will be defined by 4 things. The health of that individual or that individual health. Then is the family is also going to influence the health of that person. Third, the community where he lives will also influence. And fourth, the country where he lives is also going to influence. So individual level, family level, community level, society level. At the individual level, what are the determinants, like what are going to be defined? The socio-cultural factors which are there, how much aging population it is there, like how many people, what is the age of this person, science and technology which is available or accessible to this person. Then at the family level, the gender, the equity, the information, communication which is there from the family level. Then talking ahead is about the community level where the biological, behavioral and the human rights will come into play. And then finally at the public health system, the country is going to talk about the environmental status of the country, the socio-economic status of the whole country, and the healthcare system the country is going to provide to the citizens. That is going to be determining the health of the person. So for your exams, please note there are 4 things. family, society, community, and the person, individual. Each one will have three things. So total, how many determinants of health we see? 12 determinants of health. And these are from four categories. Four categories will cause the 12, will lead to the 12 determinants. If you can remember all the 12, very, very nice. Point number 6 is the right to health. The United Nations in year 2000, they declared that there is something called as the right to health. Every person, every global citizen of this planet will have a right to health. Then the Article 25, I'm talking of the international level. Article 25 also declares about the Universal Declaration of Human Rights. Article number 5 is about the racial discrimination. Article 11, 12, 14 is about female empowerment and discrimination against females. And Article 24 is the Convention on Child Rights in every country. Article 25 is for people with disabilities. So if you can remember, you should remember, but at least remember the right to health was given by United Nations in year 2000. Point number 7. Who is going to take the responsibility of a health? Is your health your own responsibility? Is it your only responsibility? Or your health is going to be only defined by you? Answer is no. Your health will be your own responsibility. Your health will also be your community responsibility, state, that is the area, that is the place where you are living, and the WHO responsibility. So please note that the health is taken at different levels. Individual responsibility will be dependent on your lifestyle, on your cultural factors. These are similar to what are the determinants of health. It is actually similar to what is determinants of health. So community responsibility, again, that biological factors, family factors, community factors. State responsibility is the government factors. The government factors, that is the government of India or your state government or your center government is taking the responsibility of the health, because if anything problem happens to the citizen, the people will not earn. If the people will not earn, the government will not earn. If the government does not earn, the country does not earn. So the development of a country is dependent on the health of the nation. Next is international responsibility. From your question perspective, this is important for your exam. What do you mean by the international responsibility? Talking about the international healthcare facilities, there should be some features, which is of course available from at the applicable at the national level and at international level. So the healthcare features should be appropriate, the healthcare system that you want to develop in your country. See, this whole chapter, it's very easy. Just sit back, relax, and just listen to what I'm saying. That's all. You don't need to take down notes, nothing to be doing. So healthcare features, the healthcare system of your country should be appropriate, comprehensive, adequate. Comprehensive means it should include all the areas: the mother, the child, the adolescent, the food that they eat, the work that they do. So all areas should be touched upon comprehensively. Adequate, it should be adequate. Available to everyone, accessible to everyone, affordable. There should not be too much money, and it should be feasible for the country. So these are your 7 elements of the healthcare system that we want to establish. Based on this, you can establish the healthcare in the community based on 3 levels. At the lowest level, we have the primary healthcare, which is going to give the basic healthcare. Basic healthcare. It is going to do disease prevention. We are going to prevent the disease. That is, in other words, we call it as health. What do you want to say? Health promotion. Are you getting it? A person is already having a good health. You promote the health. Do you remember we talked about the spectrum of the disease? The person is already having a good health. You promote the health is what is health promotion. Did you get that? So it's a beautiful concept for us to understand that disease prevention is what is health promotion. So this is what is being given by the primary healthcare, plus they will also offer the curative services, that is disease control services. At the secondary healthcare system, they offer some highly specialized diagnostic modalities, plus there will be better treatment facilities. At a tertiary healthcare system, there will be disability limitations, where you will do rehabilitation or highly specialized healthcare facilities will be available at a tertiary care hospital. So we have some big aims like institute, which are the tertiary care hospitals. Then we'll have some of the good quality nursing homes or some smaller hospitals. These are the secondary level hospitals. And then you have the polyclinics, or you have the primary healthcare centers, you have the sub centers. These will provide the primary healthcare. The country, the health of the country is not dependent on the it is of course dependent. It is majorly dependent. The major contributor of health of a nation is the primary healthcare system, because 70 to 80% of the people are going to land up in the primary healthcare system. So this is one of the most important aspect. I'm not saying it is the important, but it is one of the most important aspect in healthcare system. Now, talking about the responsibility of health, the international responsibility of health, let us come and talk about the international healthcare system that we have. So that is your point number 10 now, about the healthcare system, international healthcare facilities that are there. So national, you would have understood by the levels of healthcare that we have: the primary, the secondary, and the tertiary. The international levels, the WHO first of all devised that there is health for all by 2000 AD. We want health for all. So this was under the Alma-Ata conference in the erstwhile USSR. So in May 1977, the WHO devised that we want to achieve, they declared that we want to achieve health for all by year 2000. So that was one concept. Second is, there is a concept of health promotion. The health promotion concept can be asked in your question. So this is a 3 by 5 star question topic for you. What is this Ottawa Charter for Health Promotion? The Ottawa Conference was held in 1986, and they declared at that time in Ottawa that there will be a Ottawa Charter. That on the global scale, we are going to have health promotion. So health promotion in 5 basic elements. What were the 5 basic elements? Each one of them, unfortunately, you need to remember. The 5 elements are: build better public health policy, create supportive environment, strengthen the community action, develop personal skills, and reorient the health services. So these were the 5 elements which are there. And the 3 basic things that we want is to enable, mediate, and advocate health promotion. Health promotion should be enabled, mediate, and advocate to promote health promotion. That is what was the Ottawa Charter, and this is what it looks like. There are the 5 elements, and how many wings you can see from a center circle, that is to mediate. Can you see over here? This is the circle I was talking about, to enable, mediate, and advocate. From the center circle, how many wings can you see? I see 3 wings. So there are 3 wings of the Ottawa Charter, and there is a center or the nidus of these wings. In the nidus, there is the concept of to mediate, to advocate, and to promote, and to enable health. And these are the 3 wings which include the 5 policies, 5 aspects of the Ottawa Charter. You need to understand and remember about the Ottawa Charter. Then in 1997, there was the Jakarta Declaration of Health Promotion. So primarily talking for health promotion, you need to remember 2 things. One is the Ottawa Charter, one is the Jakarta Declaration. So again, talking about the healthcare. So now talking a little bit more further into the international healthcare. We already talked that the WHO wants health for all by year 2000. We already have talked that the Health Promotion Charter was by Ottawa, and the Jakarta Declaration, Jakarta in 1997, Ottawa in 1986. Now coming to one of the most important MCQ. Beta, this is almost a 5 by 5 star MCQ topic. If you are a PG student, PG aspirant, and you are preparing for a PG entrance exam, this is one topic which is very important for you, about the Millennium Development Goals and the Sustainable Development Goals. What is this Sustainable Development Goals and the Millennium Development Goals? MDG. MDG stands for the Millennium Development Goals. They were formulated in year 2000, and they were applicable till 2015. Total in the Millennium Development Goals, there are 8 goals. So many of them were health related. There was not single one which was health related. Next is, because this was over by year 2015, now we have a bigger one, that is the SDG. What is this SDG? SDG stands for the Sustainable Development Goals. SDG, they were started in year 2015. They will end in year 2030. So anything which happens in India, everything and anything, that is to be ending by 2030. How many goals are there in beta SDG? There are total 17 goals. Out of these 17 goals, which one is health related? The goal number 3. The goal number 3 is health related. Goal number 3 is health related goals. So please don't forget this. Very important. This is like a 5 by 5 star MCQ topic for your exam. How many goals were there in MDG? 8 goals. In SDG, there are 17 goals. If you just look at this SDG, this is the pyramid of the, this graph is called as a wedding cake graph. And this is what is the sustainable development goals. The WHO, the big daddy, the United Nations and the WHO, they have devised these SDGs, sustainable development goals, for all the countries to adhere. So at the lowest level, we want a good planet to live on. So at the first level, we always talk about the biospheric level, that is the good climatic system. The second system is the society system. So one is biosphere, second is the society, that is the country, that is the state. Next is the economy, and last is the top notch. This is the partnership to achieve the goals. Partnership for the goals is the goal number 17. So we want everybody to partnership for the sustainable development goals to be achieved by the country. That is the top thing. So we want integration at the biospheric level, at the society level, at the economy level. So these are your SDGs. If you just look at this SDG logo over here, or the symbol for SDG, how many dots, how many things you see? Total we see 17 goals. Hai na? Total you see 17 goals. Out of them, which one is the health related goal? This can be your question. Please note that the green color symbol with the ECG inside it, this is what is the health related goal. Health related goal is goal number 3. Goal number 3 of the sustainable development goals, these are the health related goals. So if you just dive into the goal number 3, if I just show you the goal number 3, inside the goal number 3, beta, this is a very important 5 by 5 star MCQ topic. What are the sustainable development goals inside the goal number 3? So first is the MMR. The maternal mortality ratio should be less than 70. By when? By 2030. Why? Because SDG was supposed to be finished off by year 2030. So any goal that is there, it has to be achieved by year 2030. Common sense, right? We want the neonatal mortalities to be less than 12, the under 5 mortality to be less than 25. We want to finish off. You want to eliminate under 5 to be less than 25, eliminate the TB, HIV, malaria, and neglected tropical diseases, end epidemics of these, reduce the premature deaths from non-communicable disease by 1/3. So by 2030, we want to achieve all this. So you can remember all the indicators, but of course, the commonly asked indicators are these ones which I have highlighted. So please note that this can be asked in your MCQ exams. These are what are the sustainable development goals. Goal number 3 is the health related. Next is point number 11, that what is the health services research. So we also want to have a good health of the citizen. We should do research. The research can be done at 3 levels. We can have a biomedical research, that is the biological events. You can research on the biological events, which drugs to be given, how to improve the treatment and prevention and control. There can also be intersectoral research, that how to involve more partners into it. That was also one of the SDG goals. So intersectoral research to involve more partners for taking care of the health. That's what our country also has done. We have a Ministry of Health and Family Welfare. We also have, for the health of the citizen, working the WCD Ministry, Women and Child Development Ministry. We also have the Education Ministry, giving food to the nutrition to the child. That is again for improving the health. So you have Education Ministry, WCD Ministry, Food Ministry, Ministry of Finance working for budgeting it, and the Health Ministry. So everybody is working. Intersectoral research can be done. And about the health systems research, like how to improve the Anganwadi system, how to improve the ASHA system, how to improve the FRU system of the country. That is again health services research. In fact, do you know that the Ministry of Health and Family Welfare, it has 2 separate departments, Department of Family and Health and Family Welfare, and Departments of Research, Health Research, under which you have the ICMR, Indian Council of Medical Research, and a lot of medical research happens there. So that is about the health services research. Next, broad topic. So we were actually doing the concepts of health. So we have talked about the concept of health and healthcare. Next broad topic is, what is the concept of disease? See, the concept of disease, when does a person get disease? there are two understanding. A person may get dis-ease. Dis-ease can be dis-ease. So the person is not at ease in two situations. One is ecological concept where there is the person, I'm not very happy with the environment over here, I'll become diseased. Second is a sociological concept. Sociological concept discusses about the cultural factors, political factors, environmental factors, and the biological factors together. So it's the sociological concept of having disease which is more prevalent. So why people get disease? It's not only because of any biological problem, it is also because of the ecological and also because of the environmental issues. A second important point to learn in the concept of disease is what do you mean by disease, illness, and sickness. Disease is a biological concept. It is a biological problem, or what you call in medicine as pathogenicity. Pathogenicity is what is the disease. So disease is any biological abnormality in the body which can be tested. But sometimes without a disease, people may have illness. Illness is a sense, it is a sense or a feeling of not being healthy. It is a feeling, today my mood is not good, illness, that is illness. And when do you say sickness? Sickness is a social phenomenon. It is when the social role is not fulfilled. That means today you were fulfilled. That means today you were so ill that you did not go to work. So not going to work is measured by sickness, not by illness. So sickness is a social role. For example, we have sickness absenteeism. Sickness absenteeism. So what is sickness absenteeism? That means how many people in an organization, they are applying for sick leaves because they are ill or because they have a disease. So that tells you about the health status of the community also. Sickness absenteeism. So just understand, disease is the biological, illness is what is the general feeling, and sickness is when we are not able to perform the social role in the community. So thank you so much for watching this module. In the next one, we'll discuss more in detail about the concepts of causation and prevention.